Everyone, I'm Dr. Kelly Starrett with H-Wave. We want to show you one of the prescriptive sort of activities that we do with everyone who has shoulder pain. So if someone comes in, one of the first things we ask is, how might we sort of integrate some really simple positional tolerance with someone in their day-to-day life? And that led us to something we call the shoulder spin-up. So for you, if you're shoulder pain, think about moving slowly, think about taking big breaths, and stay out of positions that are very acute. But one of the things we're going to do is recognize that if this is my shoulder and I'm having shoulder pain, if this is my only position, I'm certainly not going to restore the magic that can happen with the shoulder if I don't move it. So let me introduce you to the shoulder spin up. We have Lisa here, and Lisa's going to start just by putting her arm over her head. And we're going to think about one aspect, which is rotation. So can we have Lisa scooping with the palm in the direction? Now, in this position, I'm going to have her reach up as high as she can because we're trying to get the shoulder blade to come off the body. And then I'm just going to have her slowly reach into the back seat of the car. She can even keep an eye on that hand and make the biggest arc she can. Notice the palm is scooping, and then when she needs to unwind it, she unwinds it. Again, letting the body twist and move. Now, as a basic template, we like to do about 10 of these. But if this is a sensitive side for you, go ahead and move very slowly. Give yourself permission to stay out of painful ranges. Give yourself permission to just slowly explore. But we want to get some of this active range of motion. We do the same thing going forward. But this time we're going to exaggerate reaching forward as the arm comes around. So palm is scooping, and then she's going to reach as far forward as she can because we're trying to get that shoulder blade to protract off the body. Again, 10 or so. We do it on both sides because we want to normalize shoulder function. So we'll go forward and back, then we'll switch sides, go forward and back. And for the rest of these, remember, we're going to do on both sides. So the next piece that we're going to do is simple rotation. So all I'm going to have Lisa do is just rotate a little bit side to side and just let the arms spin. And if I'm really worried about this, any motion that I get is going to be great. I'm going to try to put one hand on my belly and one hand on my back. And as I work into this, maybe I can slowly get my hand up my back if that's possible. Can I scratch myself in the back? Can I get my hand up to my bra level? And so we're just letting the body turn, but remember, can we get 10 of these each side? So maybe 20 total turns, and we're going to start to restore these crucial aspects. Again, I don't have to have these huge amplitude motions. Even small, slow movements can go a long way. Next, we're just going to go front and back, simply moving the hands back and forth. And what we're going to try to do is see if we get a little stretch in those tissues of the forearms. So just hugging myself to back, hugging myself to back, and just feeling like I can curve the hands and then open the hands. Again, the idea is just to try to get a little bit of motion in the chest wall. What's great about the shoulder spin up is it can be done anywhere without equipment, in your own home, after a hot shower, even during the day. And oftentimes we'll prescribe this for our patients multiple times a day. The next one piece is we're just going to go straight backwards. And the idea is we're trying to actually take the shoulder into what we call shoulder extension. So we're just flicking that back. And again, if it's just me moving slowly because I feel like I'm a little bit worried about this, just bending the elbows and pushing the hands can go a long ways. But ideally, we're thinking ultimately about adding speed to these things. And speed can be a great indicator that I'm starting to feel better, as if I feel safe enough to do this. That's an indicator that systems are moving in the right direction. The next piece we're going to do is just moving side to side. So we're just spinning both arms up and then just across the body. If Lisa was in two planes of glass, she's kind of just moving between those two planes. And really what we're trying to do is sneak into an overhead position in a slightly different way. We're getting comfortable with the arm out to overhead, and we're seeing if we can open up this chest wall a little bit. So at the same time, she could even add a little bit of side bending. Again, you could stop in a range that feels comfortable. You could stop if you had one shoulder that felt a little achier than the other shoulder. You could just do one shoulder at a time. Very, very simple. Lastly, keep in mind that the shoulder is capable of doing a lot of things. And one of the last things I want to do is just get you reaching over for your seatbelt. So we're just going to pull this hand across. So we're less interested in what's happening in the back and more interested in what's happening as the hand comes across the body. So I'm leading with the pinky, and we're just getting comfortable with this motion, because this is a painful position for a lot of us. So if we can begin to add some motion in there, we can go a long way towards restoring a function. Bottom line, it doesn't matter what order you're doing these things in, it doesn't matter what speed you're doing these things, but if we can begin to have you approximate some of these key shoulder positions, often we see that that really starts to change how your body is interpreting what's safe and what's not safe, and get you moving much closer towards a shoulder that you can trust and believe in that's pain-free again.